4 years ago, Allison Johnson had no way of knowing how much her newborn son's stay in the Pediatric Intensive Care Unit at the Blairy Batson Hospital for Children would change her life.
My husband and I had a son who was born with a congenital heart defect that of course required hospital admission from his date of birth. We spent a long time in here, initially 4 to 6 weeks. Had his first open heart surgery here at Batson when he was 6 days old. So, you know, I owe a lot of what we have with him, I feel like, to the staff and the doctors here at this hospital.
And after 3 open heart surgeries, Tanner, now nearly 5 years old, is doing just fine. And Allison, she's back in the PICU.
To come here was a complete 180 as far as my nursing career. But I have loved every minute of it and have really felt comfortable here, and the teamwork here. I've never worked with a better group of employees that really work together well as a team. I really feel like I was meant to be here, that I was put here to be able to give back to the families and do what was done for me. And I've been here ever since and have never looked back.
Allison's such a leader, and she has a different perspective. When we're sitting around a table trying to solve a problem together, she can bring in 2 perspectives, the nurse perspective and then the parent. We tend to sometimes forget that perspective being healthcare providers, and we tend to think that we always know what's best, and we sometimes have to sit back and let that family be involved in that care and that plan for that child, and she helps to keep us straight on that.
But Allison's not alone. Each nurse in the PICU has a reason for being there. Some like the fast-paced environment or the constant opportunities to learn, but all seem to value the difference they can make in a critically sick or injured child's life.
You know, nobody likes to see a child in pain. Nobody likes to see a child who's sick, and so that's an obstacle that you have to deal with. I mean, it's just a reality of what we do, and it's not for everybody. You know, I always tell new nurses, particularly, that they should be very proud that they have what it takes to be able to work with critically ill children. It's a gift. It really is.
I like being the support for the families when they have, you know, this is one of the worst times in their life. Count on you for their support and everything. I like being that support and just taking care of the kids. If you're looking for a fulfilling job, this is it. You'll go home every day and feel like you made a difference. That is probably the best part.
Don't you wish all the patients were like this?
I do.
What kind of patient is Nathan?
The best patient I think I've ever had.
Why is that?
Every day I've been here since Monday, I leave in a great mood. It makes him smile all day long.
He's a cute kid, isn't
Yes, he is. And I don't want to let him go upstairs.
Where's your girlfriend, Nathan?
Who's your girlfriend? I love the intensity of it. I love to see children get better very quickly, and that's the environment that we have. Right out of school, I would recommend coming here. You learn so much very quickly, and we have people that precept and train people all the time, and so right out of school it's a great place to be. It's high energy and very active. So
And very diverse cases.
Yes, for sure. Yeah, you see all kinds of stuff. Yeah. Medical, cardiac, surgical, everything. So it's a very great place to get all different kinds of skills.
Well, I used to be a paramedic, and then I had hurt my back, and I went back to nursing school, so I wanted to do something that was critical care. And I also had a child myself who was very sick, and she passed away shortly after she was born. So I just had that whole desire to work with kids who were really intensely sick from the experience of my life. We love people with other backgrounds coming in and adding to what we already know. So, because you don't want everybody always being straight out of nursing school, you know, then I'm sure we miss things that we could have brought into the unit if we had more experience.
It's the diversity that makes you strong.
Yes.
Right now they're admitting a post-operative heart patient, and as you can see, it takes several people to get one of these kids settled in and stabilized and all of that. So, team approach, more eyes are better. So, but there's a real good spirit of cooperation, and everybody's focused on making sure that the kid settles in and does well.
And it's that cooperation and teamwork that create a family-like environment in the PICU, one that fosters respect among colleagues.
The congenital heart program could not exist and would not have these excellent outcomes without the nurses. The nurses are the backbone of the congenital heart program, and in the intensive care unit and outside of the intensive care unit. But the most critically ill children with the most delicate physiology come here through the intensive care unit, and it's because of the excellent care of the nurses that we have such good outcomes.
I think not having worked here as a new nurse, I just had no idea the amount of things that get done in here that nurses are actually responsible for. It's a big undertaking, and it, like I said, it's definitely a challenge, but you're expected to use critical thinking skills, and the doctors kind of see you as residents, really, because you participate in rounds, and they come to you, with questions because you're there all the time. So there's a high expectation of just the critical thinking and being very involved in your patient. I feel very respected here, and that's another big thing, is that you're definitely respected, and that's something important to me to have in a job. So we work very well with our doctor crew, and everybody kind of gets along. We're kind of a big family.
One of our attendings here said that our job is to diagnose at the bedside, and this is a smart group of nurses. And you can't just follow orders and run through checklists. You've got to think. You've got to really be sharp. You've got to be able to look and be able to make judgment calls so that you can get the team to engage and to be able to pick up on things as early as possible. That's how you get good outcomes.
I feel very strongly it's a great opportunity, a way to invest your life that's worthwhile. Sure, it's hard work sometimes, but we also take care of our own. We're all friends in addition to being colleagues. So it's a positive environment, and you don't need to be afraid.
I really think that many nurses that walk in our doors are very overwhelmed at first just by the sight of all the equipment and all the machines and, of course, the way the patients look. But I will say that having never done this type of work and only having been here as a parent, the education that we provide and the orientation that is provided, it is outstanding. I have never worked at another facility that provided the best education and made sure that all nurses were trained and competent and comfortable before taking care of these kids. So we welcome new graduates, nurses that are coming back into a different area, and much care is taken in making sure that each nurse is ready and able to take care of these kids before they are released from their orientation.
Well, we do not expect people to come in with pediatric experience. We have a wonderful training programs. What we're looking for are people who are knowledge driven, who have a passion for taking care of children, who love high intensity, who can handle high stress situations. We need people who have very strong critical thinking skills and that can act quickly when the situation arises. The only way we're able to do what we do is because we have such a strong team that work. No one does hardly anything here alone. Admit a patient, discharge a patient. We work together. We take care of level 1 trauma, so we take care of lots of head injury. We are a very strong surgical unit, so you're taking care of multiple patients who have had surgeries and are coming here for at least 1 to 2 nights while they stabilize. We take care of open hearts now. Lots of congenital different heart defects, and those patients, they all act different, even if they have the same defect. We take care of then the medical patients, the pneumonia, the flu, the RSV. We just take care of everything. We don't separate them out. So therefore, you get a wealth of knowledge because you're taking care of everything and not just specializing in one area. These are the sickest children in the state. We are the only pediatric critical care unit in the state of Mississippi, and we are a special group of people.
If you're thinking about working in a PICU, you should know that it is the most difficult, rewarding career I think that you could ever ask for. And you will get far more from the patients and families than you will ever give.
How's your son doing now?
He's doing wonderful. He's very healthy, and he will be 5 years old this summer. So
Is there a day when you're working here that you don't think about him?
never. never. And I feel truly blessed. I think, like I said, I was put here for a reason to recognize and be thankful for what we do have, because we see so many sick children, and while there are so many miracles that come out of this unit, there are also some very sick children. So I think I'm reminded every day of the blessing that we have at home.
To learn more about nursing opportunities in the Pediatric Intensive Care Unit at the Blairy Batson Hospital for Children, go to nurses.umc.edu.